Now I'm going to explain, after my last video of explaining how to properly place an NG tube, I'm going to explain how to properly remove one. And one thing that I forgot to mention in the last video, whenever you're inserting an NG tube, you want to make sure that you discontinue the procedure if the patient has any kind of respiratory distress or isn't able to speak or hum, or if they have any signs of cyanosis. You want to discontinue it and take out the NG tube immediately, because it probably means that it was improper placement. And so in order to remove an NG tube, you want to make sure that it's not, first off, you want to make sure that you perform proper hand hygiene and make sure you have the right patient and physician order, and make sure that you're not taking the NG tube out of the wrong patient, because that would be bad. And then once you're done that, you want to actually put a towel over the patient, just to make sure no secretions or anything get on their gown or clothes or whatever they may have on. And then you want to make sure that the NG tube is not attached to suction or a feeding or anything like that. And then you will take the tape or whatever is holding it down and loosen all that up. Make sure whenever you go to pull it, it's not going to still be attached to the nose. And then once you're done getting the tape all loose, you want to pull the NG tube out slowly and steadily, and tell the patient to hold their breath to make the procedure, I guess, easier for them. And then once you take it out, you want to dispose of it properly and provide any kind of oral or nasal care that you might need to after taking that out. And then once you're done, you can actually doff off your gloves, perform hand hygiene, and document any kind of findings that you might have been abnormal, or just chart that you actually performed the procedure.